Hello, everyone. My name is Sarah Cutchin, and I'm the Partnership Lead on the Adolescent Immunizations Communications team here at CDC. And we are so happy that you could join us today for another preteen vaccine webinar. So today we have another great presentation planned as Dr. Beth Koslap-Petraco will be sharing some of her experience and work to empower clinicians around HPV vaccine during AFIX visits. Very quickly, we have a couple of housekeeping items to go over. First of all, I want to remind everyone that your lines are muted. Please do not put your phone on hold. And if you do need to step away, you definitely can. Feel free to hang up and then dial back in when you can. And then we'll have a Q&A session after the presentation. So as you have questions, please go ahead and type those into the chat panel in the lower left-hand corner of your screen. Then when we do get to the Q&A part, we can read those questions out loud, and so then everyone can hear the answers. So to get started today, before we hear from Dr. Koslap-Petraco, we wanted to go ahead and get a sense for what you think happens or what does happen during an AFIX visit. So we have a few polling questions to get us started. The first one is, education during AFIX visits would empower clinicians to offer HPV vaccine more often. And so if you could answer this true or false. Wow. Overwhelming response. Excellent. So then we'll go to the next polling question, which is, which materials do you think would be most helpful during an AFIX office visit? And you can select multiple types of materials. This is excellent because here at CDC this helps us understand what would be most useful for you guys as you're out in the field with your feet on the ground, making the difference in empowering clinicians and nurses and assistants, and what would be most helpful for you guys. So this is great. Excellent. All right. Well, today we are so excited to have an HPV vaccine champion with us. So we'll be hearing from Dr. Beth Koslap-Petraco. She is the coordinator for child health at Suffolk County Department of Health Services and a clinical assistant professor at Stony Brook University School of Nursing in Stony Brook, New York. She is a nationally known expert in immunization practice and has been an advisor for the CDC and has served on the advisory board of the Immunization Action Coalition as well as the National Vaccine Advisory Committee. Dr. Koslap-Petraco has advised local and state health departments on immunization public policies, using her expertise as a public health nurse to influence system-level changes. Dr. Koslap-Petraco is the PKIDS online advice nurse and a member of the executive board of Every Child by Two. She is a fellow of the American Association of Nurse Practitioners as well. Dr. Beth is widely published and has authored chapters on immunization in multiple textbooks. And so we are so excited to have her speak today and to hear from her regarding her work and her experience. And so with that, I will turn it over to her.
Well, good morning, everyone. Actually, good afternoon, and good morning to my colleagues who are outside of the East Coast time belt. I'm really thrilled to be here with all of you, and I'm very honored that CDC has asked me to share my work with the AFIX visits that we do here in Suffolk County. So just to give you a little idea about what goes on here, ACIP said that we should start giving HPV vaccination information to all of our providers, and that the vaccine is to be recommended at 11 years of age. In my neck of the woods, and I don't know if it's the same in yours, the providers have been notoriously slow to do this. I get one excuse after another. I don't want to talk about it. It's too soon. Why are we doing this? We don't want to talk about sex. You name it, I've heard the excuse. And the providers actually blame the parents and say, oh, the parent doesn't want to hear a thing about it. They don't want to hear about sex. They don't want to hear about any kind of vaccine like this. They've heard all these stories on the internet, so I don't even want to bring the subject up. But on the other side of the coin, the implication is that if the vaccine is given to these adolescents, it's going to initiate or increase their sexual behavior, which really, really isn't true based on the literature. There was a really good study done that asked parents why they didn't allow their children to be vaccinated. And guess what the finding was? It had nothing to do with the parents as much as with us as providers, that we were not really doing a very good job of offering the vaccine and empowering the parents to want to give this vaccine to children. And that's exactly what I found when I started going out to do AFIX visits. Honestly, here in New York, a lot of my public health nurse colleagues really don't like doing the AFIX visits. I honestly love them. I get out and I get to talk to the providers, and they find out that we're their friends and we're there to help them, and we're not there to hinder their practice. Our bottom line is, what can we do for you that's going to make you more willing to give this vaccine and help you to get this job done? Another issue that was raised in that study, and I believe it was a CDC study or supported study, and you can see the reference at the bottom of the slide there, was that the male providers were even worse than the female providers at offering the vaccine and bringing it up. Let's be honest, pediatric folks don't like talking about sex, and that's really, really borne out in the literature. But as a mom myself, and having raised two sons, we really can't bury our heads in the sand about this issue. It's very important for us as parents and providers to be realistic about what our children are going to do. No parent ever wants to think that their child is going to have sex. And I say that to parents all the time. I know your children are not going to have sex until they grow up and get married. He, he, he. But honestly, when I say that to a parent, it kind of like, oh, okay, well, she's saying something to me that's going to make me feel that she's acknowledging that my child is not going to be sexually active, because that's what the parent wants to believe. But on the other side of the coin, we can't bury our heads in the sand about it either. I've told this story before, and some of you may have heard it, about my own teenage boys. We had the condom drawer, and I promised them that I would never, ever say anything if the condom drawer became empty. Well, one day the condom drawer was empty. And, of course, as a mother, I started to panic. I said, oh, my God, what are my sons up to? And I questioned the younger son because it was a weekend, and I really didn't have access to condoms until Monday. And I said, gee, what happened? The drawer is empty. And my son turned around and said, oh, Mom, I'm handing them out at school. I was like, you're what? He said, yeah, Ma, you'd be surprised at how many STDs and how many pregnancies we prevented by handing out all those condoms. Now, I'm not recommending that for every parent, but it's just kind of one of my little personal stories about issues that were raised with my own children. So that's why we kind of really have to be very aware of what parents are doing and what parents are saying. And don't be afraid to share your own parenting stories with other parents, because sometimes it makes them feel a little bit better about deciding what they want to do and when they want to do it. Okay. So what was my setting? We did a study asking parents why they didn't want to allow their children to receive the HPV vaccine. This was really very informal, nothing fancy, and the finding was that parents said the providers didn't want to recommend the vaccine for their children, and that the male providers in our neck of the woods were saying the exact same thing. This paper came out of a QA study that I kind of did here with my patients here in the health department, and I wanted to see if this very informal look back that we did here was really backed up with the literature, and it was. So our population. Healthcare providers working here in offices and the federally qualified health centers here in my county. It's a huge county. We're bigger than a lot of states. And my job is to go around and visit them all. We have to visit all the federally qualified health centers here in our health department, in our county, as well as another 44 private providers. So that kind of gives you an idea of how big our population is. The office staff were asked if they were to follow the recommendations of the providers. And that was a big issue for us, too, because when we looked at what the providers were saying, if they were pro-vaccine, so were the folks in the front staff. if they were kind of like hanging back a little, the front desk staff people, who very often can be the ones who convince the parents to take those vaccines, they kind of were the same way. So one of the things that we did emphasize to the providers was making sure that everybody in the office was on board. We need to have everybody saying the same exact thing using the same words. Data about provider attitudes was found in the literature, and as I mentioned, they were really supported during the private provider visits. Here in Suffolk County, most of our pediatricians are in multi-provider offices, a combination of physicians, nurse practitioners, physician assistants. We don't have very many single providers left anymore. They find it just too very difficult to practice when they're all by themselves like that. So it really made a big difference in systems, because remember I mentioned I really am very interested in system work, is to get the whole system to be saying the same thing. So what was my PICO question? For those of you who don't know what a PICO question, and for evidence-based practice, that's the question that we look at to determine what we're going to study. It stands for population, intervention, comparison, and outcome. So my question was, do providers who receive an educational intervention during AFIX visits offer HPV vaccine to 11-year-olds at a higher rate than they did before they received the educational intervention? Now, it's really important to get that vaccine into those children at 11 because we really have good data that clearly indicates the younger we give this vaccine, the better it works. I've heard that argument from several private providers when I'm in the process of making my AFIX visits. They always say to me, well, why am I giving it to an 11-year-old when they're not going to have sex until they're late teens? But now we have some really good data to show these providers that says, look at this. If we give it to the 11-year-old, it continues to protect them well beyond what it does the later that we give it in adolescence. So I'm really happy to present that data to them. One thing that doctoral work really does to you is tell you to get into the literature and and look at the studies and be critical of those studies and use them to our advantage. So my project description. The State Health Department here in New York expects every AFIX visit to include specific information to providers regarding how HPV vaccine for those 11 to 12-year-olds. The goal was to increase the vaccination rates. And again, why did they really put this emphasis on us? And I think it was at the urging of CDC, because while this is great vaccine, we are not doing a great job of getting this vaccine into our target population of the 11 to 12-year-olds. I'm certainly not saying that it's not useful to give it for catch-up whenever you catch these adolescents. But as I mentioned before, goal is to get it into them at 11 to 12 years of age because that's when it works the best. So the studies were presented regarding provider practice knowledge and attitudes. And some of the providers were really kind of taken aback when I showed them that data. They were like, and these are the same providers who were telling me that they didn't want to discuss it because they were afraid that the parent didn't want it, or they felt that it was going to encourage sexual activity earlier rather than later, or all of the other excuses that I heard from providers saying that they really weren't, it wasn't their fault that their numbers were so low. Personal stories about HPV were also shared with providers. I have a personal stake in this myself. My grandmother died in 1955 from cervical cancer, and I can almost guarantee you she never once had sex with anyone other than my grandfather. My grandfather was an immigrant from Eastern Europe. Now, it wasn't pretty at all. I remember the white sheets up to her neck, and I remember my aunt cleaning my grandmother up several times a day, and her room always smelled wonderful. It smelled like lavender, and I know why, because my grandmother rotted from the inside out. Because unfortunately she had cervical cancer in the days before we were doing regular pap smears, and by the time they discovered it, it was far too late for them to do anything to help her. I share that story with every provider that I meet because I want them to know how important this is, that I have a personal stake in this, and it was a very dear family member who lost her life to HPV disease. In fact, you all hear me, I'm Mary Koslap-Petraco. My grandma was Mary Koslap, and I'm very proud to carry her name. And part of my memorial to her is carrying around that name and sharing her story with as many people as I can, so that others will vaccinate and vaccinate early. And by all means, you can go right ahead and share my grandma's story when you make your AFIX visits. I have other personal stories of young women that I've met who wound up with HPV disease and then wound up with colposcopies and other interventional treatments that resulted in them not being able to have children. Now, I hear a lot of the treatments now are much more sparing of the cervix, but still, anytime you have to do anything to a cervix puts that woman at risk for not being able to carry a pregnancy to term. Share those stories. Share those stories with those providers that you meet so that they have something to hang on to and a story to share with a parent. I've really come to believe in my AFIX work, the more we personalize these visits, and I saw when you were doing your survey that you also believe that personal stories can be very helpful in convincing providers to change behaviors. So get yourself a whole bag full of personal stories. Use some of the ones that I've given you, some of the ones from your own personal experiences. And when you're making those AFIX visits, don't be the cut-and-dried person who walks in there and says, well, here's the studies, here's the handout, I want you to increase the vaccine rates. It doesn't work, and I've seen that. Also, the other thing that I found was very colorful, was very helpful, were those colorful handouts from AAP and CDC. I mean, the ones you just saw the logo right now on the slide deck to begin with. That is a very eye-catching logo. Hand that one piece of paper to the provider and say, "Cheapers, this is a really good handout to use for your patients." Direct them with the links if they want other pieces of information. There's great links on CDC's website that you can give to the provider, that you can give them a live link that they can just point, click, print, and make sure they're in color. So these are what my outcomes were. We did 43 post-assessment visits in 1 year. This year I did 44. 13 of the practices increased their HPV immunization rates, and that was after I had visited them the year before. 8 of the practices increased by 1%. One of the practices increased by 2%. 2 of the practices increased by 6%. One practice went up a whopping 23%, and another practice an even greater whopping 28%. And these were all practices that I had visited the year before and talked to them and shared the personal stories about HPV disease with them and the impact on not just my grandma's life, but on several other women that I had met. We were also fortunate in New York State last year at our adult immunization meeting to meet a woman who's an activist for HPV vaccination. She came and she sang to us about what it meant to her to be vaccinated and to have people taking care of her. She was one of the women who had had a lot of interventional surgery and was no longer able to have children. That made such an impact on me and my other public health colleagues when we heard her speak that day. And I think if any of you are on the line from New York, probably most of you heard her speak because we had her come to our adult immunization meetings last year. But she had such an impact on all of us. She was our last speaker of the day, and boy, did she wake us all up. Talk about her. See if you can get her to come and speak to maybe your local AAP meeting. Because she really does excite people and get them on board with what's the best thing to do for the children and keep them from having to face the same issues that she had to face. So I did see some small increases in some of the practices, and honestly, if any of you know me, you know I have OCD, and I wish that they were greater increases. But they were certainly better than getting a 0 increase. And while it was small, for me it was the first step. Some of the other practices, as you saw, had much larger gains. And the practices who used reminder recall were the ones who had larger gains. And again, It's backed up in the literature using reminder recall. And I know almost all of you have registries now. I know in our New York State registry there's a reminder recall feature built right into our registry. And that's another plug for the registry, honestly, to make sure that everybody gets the appropriate number of doses with the appropriate intervals between those doses, is reminding your providers about how important the use of the registry is when they're vaccinating for anything, but really pointing out to those adolescents that that's going to be a gift that they're going to take with them for the rest of their lives, is to be able to go back and view that vaccine that they received on their state registries. Like I mentioned, while we had some increase, a small increase in some of the practices over previous years from administration, I was really, really thrilled with those large increases. But for me, any increase at all was better than nothing. Because before we started doing this program and we were just looking at HPV rates, they were zero, nothing. You know, here in our county, we would run those AFIX runs, and there was absolutely no increase at all. And I'm talking about practices that had zero as far as the number of adolescents who were appropriately immunized or who had even gotten one dose. So for us to have a 1% increase, that was a big, big change for us. And honestly, my staff believes that concerted efforts to educate these providers accounted for this increase. That was the only thing that we had done that was different. Before, we never talked about it, or we didn't share personal stories, or we just would include a handout. In the past, we would just have handouts in our AFIX packets, but now we were really putting a big emphasis about speaking with providers. Another provider told me a story about, and when I said to her, I said, this is really important, this is why we need to do this, and I shared some of my personal stories with her, and she said to me, well, I really don't push it. I just give the parent the VIS and tell them if they want it, they can have it. But she said, I had a girl who was infected with one of the strains in the vaccine, so I figured, why bother? So that was a perfect opportunity for me to say to her, but it's only one strain, and now we have a 9-valent vaccine now. You can protect that adolescent against 2 strains of warts, plus all those other strains of cancer-causing strains. So why would you want to not do that, especially with a girl who's had one strain already and has already had all of these interventions? And she sat back and she said to me, gee, I never thought about that before. And now I'm really going to be interested to see what her data looks like next year after we had that conversation. So what are our implications? We plan to go back and do a 6-month follow-up to visit these targeted larger practices and see what kind of differences that makes. That's what our practice is here in New York. We get all of our AFIX visits done within the first 6 months of our contract, and then the second 6 months is when we just do another run for those practices, and then we call them on the phone and we talk about how we did. And they all, of course, want to do better. I just finished all my in-office visits, and they're all kind of waiting with bated breath now until we do our second run so they can see where they've made their improvements. They're all looking to do better with HPV, because I think we're finally starting to get to them that this is really important for the lives of every single adolescent. And, another thing about telling the mothers, what I've suggested to the adolescents is, what parent doesn't want to prevent their child from developing cancer? This virus causes cancer. And that virus infected people like my grandmother and people like that wonderful young woman who came and sang to us. So we're preventing an infection that causes cancer. We're looking to generate more improvement in those practices that either didn't improve or decrease the number of adolescents that got HPV vaccine, because we've had a few of those too. Maybe they were at 2 or 3% of their adolescents being fully immunized, and then when we went back the second year, they dropped to either 1 or less. As I mentioned, we have practices here in Suffolk County. When we did their AFIX assessments, they were 0 for HPV vaccination, which to me is totally unacceptable. So what we've done is make our efforts to improve the immunization rates, and we want to continue to build on all of those past successes, using those personal visits, using those personal stories talking to providers on a one-to-one basis. That was another thing that I thought was really, really important, was getting in there and speaking to the providers themselves. Sometimes I come in and the appointment has been made with the office manager or the lead nurse in the office, because that's another thing here in Suffolk and in New York State. In New York State, vaccinations are only permitted to be given by physicians, nurse practitioners, physician assistants, registered nurses, and LPNs. We do not allow med techs to do the vaccines in our state, which I know is probably very different from the vast majority of you who are listening in today. But you can empower those med techs as well. So whoever you're doing your AFIX visit with, kind of keep your eye peeled for the provider, because once those numbers start coming out, even if the provider's busy, they pop their head out of the office, and you can get a good relationship with whomever you're doing your AFIX visit with to get the provider to just kind of pop over for a minute or two just to see what their numbers are, because one number is really very effective and really is a part of your quote-unquote sales pitch. Because when they see that there's 0 for adolescent vaccination for HPV, that really gets them to take a deep breath. And they're like, oh, I don't want to be the one known as the person who has 0. I mean, I'm sure that you're all just like we are in New York State, and all of this data is aggregate data, and it's confidential, but I certainly can tell you that there are providers and in Suffolk County, which is the way our data is aggregated. So they don't want it to be known that they're the providers who have 0 rates for those vaccines, even though we do assure them that we don't share their names with anyone else. But, providers talk amongst each other, and especially when they do a really good job, they like to brag. So they'll, oh, did you know I had, because I've heard them at meetings, did you know we had an AFIX assessment and we were over 90% for our babies, or we made a big improvement this year with our adolescent vaccines, and this is how we did it. So those are the kinds of stories that you want to foster in them and make sure that you can get your hands on the provider. The best times to go to make the visits, and this is when I usually go, is early in the morning before they start seeing patients, late in the afternoon after they're done, or at lunchtime, because that's usually when you're going to be able to catch that the provider themselves and speak to them. I keep putting a big emphasis on the provider, but I also want you not to forget about every other person in that office, from the person who's at the front desk. I've heard it myself when I've been in office practices. The mom will say, is my child getting shots today? And the office manager or who's ever at the desk might say, oh, yes. You can discuss it with the provider, but that's certainly a good opportunity for the person who's sitting at the front desk to say, isn't it great that we can vaccinate children and we don't have to run those risks of those vaccine-preventable diseases? Just one little word like that can be a big push for a parent to decide to give their child the vaccines. And also a negative word is going to be very detrimental as well. I've also been standing at the front desk and heard the front desk person, when a mom mentions vaccines, saying, oh, I really don't believe in them and I don't think they're that important. Meanwhile, the provider is very pro-vaccine, but he doesn't even know that his front desk staff are saying negative things to parents. So you need to know what every single person is saying in your office and make sure that you're all saying the exact same thing. A lot of times parents, again, they go to the University of Google to look up things. And I'm sure they're going to come to you and say, but I read it on the internet that young girls died, or young girls developed multiple sclerosis or diabetes or some of these other horrible things that are circulating on the web about HPV vaccine. So you need to be prepared to speak to those issues and have every single person in your office speak to those issues as well. So it's not bad to sit down with all of them and talk to all of them and see exactly what they think about those vaccines, because that can make your job a lot easier to get that provider on board with a lot of support from his office staff. How do you reply to those things about those deaths? And you say to the mom, I've done everything I possibly can to learn about this vaccine. And when I looked at those studies to find out what young women were dying from, it's because of the way those studies are constructed. No matter what they die from, within a certain period of time following the vaccine, it gets put into part of the data. And you could say to the mom, did you know 2 of those girls that were supposedly died from HPV vaccine were in car accidents, and that's what they died from, but nothing related to the vaccine, but because they were vaccinated within 90 days of their deaths, it was included in the numbers? Or did you know one of those girls was murdered? You need to clarify that data for parents, because like I said, they go to the University of Google and all they see is 9 girls died from the vaccine instead of what the cause of death was. So just keep those things in mind when you're making your AFIX visits. Talk to everybody from the time you put your foot in the door to the time you leave. Smile and make friends with all of them, because you never know which one of them is going to be an ally and convince that parent to get that vaccine. So for me, this is all about the personal touch and going in there with a smile on your face and the best available data that you can find to talk to every single person in that office to get them to get their rates up. So with that, I think I'm going to end here, and I'm happy to answer any of your questions.
Awesome. Thank you so much, Dr. Koslap-Petraco. I think I'll also add, you were talking about personal stories. I don't know how many of you have seen Someone You Love, the HPV Epidemic, but I confess I just watched it yesterday, and if you have not seen it, you should definitely watch it. I think it's available on the PKids website.
Yes,
for free.
It is.
Yeah. Yes, go if or you can just show that to the entire office, and that's definitely a good icebreaker and excellent stories all the way around. So with that, we'll let Dr. Koslap-Petraco take a second to breathe, and we'll go into our audience polling questions just to see how helpful did you guys find this information that Mary Beth presented today. Awesome. Always good to see that this is relevant for y'all. And then the second polling question is, how likely are you to use this information that was presented today? Nice, and about the same. Excellent.
See, my feeling is it's not knowledge till you give it away, and I've learned a lot from a lot of my other public health colleagues, and I'm really happy to share the things that we've learned here in Suffolk County with my colleagues throughout the country.
Awesome. Okay, and with that, we will get started with the questions that have been logged.
Thank you. The first question is about the presentation slides. Will these slides be available to webinar participants?
Yes. If you want to share my slides, you're more than welcome to share them.
And we'll send out the slides to everyone who registered. It'll be a PDF, so you won't be able to edit them or anything, but they will be sent out. And I'll go ahead and plug our preteen newsletter. If you are not already on that, you can send an email to PreteenVaxScenes@cdc.gov, and we will add you to that, or just respond to the invite for the webinar, and we'll add you to that. That way you'll have all of our information as it's up and ready.
Thank you. The next question is, I realize that 11-year-olds need their vaccines, so why not start the HPV vaccine at 9 years old?
Well, the reason we start at 11 is because that's what the recommendation is from the ACIP committee. There is an alternative recommendation to start it at 9 if you think that the child is sexually active or who has been sexually abused. The reason why we really shoot for that 11 years old is because we like to bundle those 3 vaccines together. When I give those vaccines, I say to the mom or the parent or whoever's the guardian with the child, I want to give your child a meningitis vaccine, one that prevents whooping cough, and one that prevents cancer. So when you look at adolescents, it's kind of tough to get them in. So when you're getting them in for that 11-year-old visit, that's why the 3 vaccines are bundled at that age.
Thank you. The next question is, when conversations about sex come up, do you find it's better to just redirect the conversation away from sex and reframe the conversation to cancer prevention?
Well, it depends on how the parent raises the question. What I would say to what I do say to them is, this is a cancer-causing virus. We never know when our children are going to become sexually active. So the sooner we give this and get that protection on board, the better. And then I would finish it off with, I know that your child is going to wait a long time because I wanted my children to wait too. You want to do something to let the parent feel that it's not all about the sex. But still not ignore that question altogether. And that's kind of the way that I would phrase it, is that we want to make sure that we have this on board so when your child does become sexually active, they're protected against this virus. And the other piece, too, is I almost forgot. The other piece to this, too, is the younger we give this vaccine, the better it works.
Thank you. The next question is, how many AFIX staff do you have in your county?
Are you sitting down? 2 of us. There's 2 of us who do the 44. Besides, we run our pediatric immunization clinics as well, and we have another nurse practitioner who helps us with with our clinics. But it's 2 of us who do the AFIX work. A lot of work.
Thank you. The next question is, other than CMEs and good timing for visits, what are some other methods you have used to get clinicians to attend AFIX results? Any stories would help.
You mean to get the clinician to come and listen when I come in the door?
Correct, to attend AFIX visits.
Okay. Well, we do call ahead of time, and I try to always schedule the visits when I know that the providers will be the least busy. The other thing also is making sure they see me when I'm there. You know, usually we're in a hallway somewhere or walking down a hallway, and I usually will say to whoever I'm meeting with, where is the provider situated right now, so that I make sure I can try to get into the hallway with them. And then they always want to know who the strange person is who's there. The other thing, too, is really making friends with whoever you go into the visit with, because a lot of times if you spend a few minutes and say, this is really important. Could I just have a minute or 2 with the provider? And I'm very rarely, if ever, refused.
Thank you. The next question was about the video you referenced earlier. What was the name of that video?
The video that's on the PKids website?
Yes.
Yes, that was the video. Now I'm having a brain freeze. Can someone just tell? It's
Someone you love.
Someone. Thank you. And if you just go to PKids, it's like right in the banner. When you go right to the website, if you just do pkids.org, it should come right up in the front banner for you. You don't have to search for it, and then you can just click.
Thank you. The next question is about the data you presented about why vaccinating at 11 years old is appropriate. Can you let us know what the source of that data was again?
Yes, it's on the bottom of the slides. When you get the slide deck, you'll get that.
Thank you. The next question was, what was the name of the woman who sang and did a speech to New York public health professionals?
Can I get back to you with that one, because I don't remember her name, but I'm gonna query my New York State Health Department colleagues. In fact, if any of them are on the line and they want to type into the chat box, that would be wonderful. But we have several in New York State, each region has an adult immunization meeting every year, and I believe every one of us had her last year, and she was just absolutely sensational. And she does travel. If you pay her expenses, she travels. Oh, there it is. Sharon Humiston, Christine Blaze.
Thank
in fact,
you.
a few of you have have popped in. It's Christine Baez, B-A-E-Z.
Thank you. Next question. Do you have any advice on getting in the floor or promoting this type of QI work? This would be greatly appreciated.
Could you just repeat the question, please?
Sure, I can give you some more background. The time commitment from site has been difficult for us doing similar work, and getting in the door and face-to-face with the MD or NP has been our challenge. Any advice on getting in the door or promoting this type of QI work?
A lot of phone calls. I have to admit it is a tremendous amount of phone calls to get in the door, because I don't always get an appointment with the first phone call, and then it's making follow-up phone calls. If you had an administrative assistant who could help you with those phone calls, we have found that very helpful. We do have an administrative assistant who helps us with the phone calls. Some of the phone calls I have to get on myself, because they're like, why do you have to come? But the big thing is with AFIX visits, they can't refuse you. And sometimes we just have to say that to them. You are using VFC vaccine. One of the things that you agreed to is an AFIX visit from us. So let's pick a date right now.
Thank you. Do you have any info about infertility after taking the HPV series?
Infertility after taking the HPV series, I don't have that at the tip of my fingers, but that I can look that up for you, because there has been no damage to infertility. I know that study was done, and it was it came out through, I think it was in one of the MMWRs, about the purported damage to infertility from HPV vaccine, and it was totally discredited.
Thank you. The next question is, are the AFIX visits conducted at the same time as the VFC compliance visits?
Usually not. It's very difficult. Again, our county, there's 1.4 million people in our county, and it's very difficult for our New York State colleagues to always make it around when we're doing our AFIX visits, and they do their VFC visits. In fact, a lot of times I've gone to offices and they'll say, "Oh, well, aren't you coming next week?" I said, "No, that's the state folks, because they come with the special thermometer as part of our AFIX visits." And I'm sure all of you who make those visits know that you do check temperatures in the refrigerators, but we don't come with the special thermometer like the state does. So honestly, in all the AFIX visits I've done, I've never ever been able to coordinate with the state folks to get in the door at the same time.
Thank you. Our next question is, do you conduct any AFIX feedback meetings via webinar?
We don't do them via webinar because, again, I just get in my car and I feel like Willie Nelson. In fact, I just finished all my Willie Nelson visits. It's the time of the year, and I drive. I mean, the farthest away that I drive is 2 hours away, but I hear my colleagues in Hawaii have to fly from one island to another to do all of their AFIX visits. So I sure can understand how difficult it is for some people. But we were told it had to be an in-person, face-to-face visit. So that's what we do.
Thank you. The next question is, what strategies can you share with us in reference to the amount of pain at injection site that the patient experiences? This seems to decrease the willingness of children wanting to come back.
Yeah, that is a big issue. I tell them ahead of time that it hurts, and I tell them that their arm's going to feel like they got punched the next day. This way they're prepared for the discomfort following the vaccine. But what I also say to them, wouldn't you rather feel like your arm got punched than to have cancer? One of the things I say with the boys, in fact, one of the strategies that I use with the boys, sometimes if the mother is hesitant, I'll say to the boys, do you know that this vaccine prevents cancer of the penis? And I've yet to have one of the boys say, "Ma, don't sign the paper." In fact, I say that to them. That's an easy sell with the boys. Yes, it hurts, and I'm really sorry that it hurts, but it's certainly better than having cancer of the penis. So it's kind of just a little something to give them, and then I tell them to also cold water on a washcloth afterwards. I really understand that it hurts, but honestly, I want you to be healthy, and a sore arm is a small price to pay for not having cancer. So, you know, a lot of them is like the mental issues with the children as well, but I do tell them and I warn them ahead of time. We also give the HPV last in, like if I've got other vaccines to give them, I give that last because it hurts the most, and I warn them. And that strategy seems to work for me, and they do come back.
Thank you. Next question is it true that some strains of HPV can be spread through close physical contact other than sex and or deep kissing?
Yes, it's true. You know, children play with toys. They play with fingers, and I understand that it can be transmitted that way. I don't have the reference at right now, but I could get that. We can look that reference up. It's rare, but it can happen.
Thank you. The next question is, which IIS system do you use? Are you going to participate in the STC AFIX schedule that is being developed?
We use it's called NISIS, or New York State Immunization Information System. I know ours was built off, and my New York State colleagues, if they can help me with this one, because I don't remember what state it was built off, but it's very user-friendly. There's so many features on it. You can get all kinds of data from it. I mean, I honestly don't know how we ever vaccinated without it. And I don't know the acronym for the second part of the question.
It was, one moment. In the STC AFIX module that is being developed.
I don't think I've seen that yet. But in New York State, the way, and I'm sure all of the other registries are very similar to New York State's. I know New York City's is because if you're a provider in New York State, you can ask New York City for access to their registry. And the two registries do speak to each other now. New York is almost like a state unto themselves in New York. And it's the way it's set up right along the ACIP schedule, like all the intervals, and then on the bottom of the way ours is set up, on the bottom is where it tells when the children are next due for the vaccine, with the earliest date, the late date, and catch-up is all right there for you. And that all follows the ACIP guidelines.
Thank you. The next question is, during your 6-month follow-up visit, do you sample the same population that you sampled during the first visit?
No, we use another population. So we want to see if there's an improvement now that the office has made changes to the children they're continuing to see. So we use another, and that's the way the AFIX reports always go. You put the dates in, and then the computer chooses the patients that you're going to look at. And that's where you're going to see your improvement. You want to see if now that they've made changes, the children that they're continuing to see are now getting vaccinated, as opposed to the ones previously who didn't get vaccinated. And that's the way QI studies are usually done.
Thank you. The next question is having an AFIX visit in part of your VFC provider agreement?
Absolutely.
Thank you. The next question is, do you do these visits annually, and do you have 100% compliance with the visit sites every year?
Yes, we do, and if we didn't, we would hear about it with our contracts. We, as part of our contract with New York State, is we guarantee them that we will complete the number of visits that we contract for. The way they come up with the number of visits is depending on what your population is in your county and how many pediatricians there are. So that's how you determine. I mean, some of my upstate colleagues, there are only 10 pediatricians in the entire county. So they survey those pediatricians every single year because that's all there are. In my county, we have over 360 pediatricians, or 360 providers who see children, because that does include the family practice people. So that's how we come up with our number of visits that we have to make every year. And if we didn't finish it, then we would have to finish it in the next grant year, because that's the way the contract is written. You sign off, or your commissioner signs off, that you will complete that work in order to get the reimbursement from New York State, which ultimately gets the money from the CDC in order to perform that work. It's a public health function.
Thank you. The next question is, have you heard or have any advice on the balance of the AFIX visits with their clinic quality improvement visits that providers are also experiencing?
Could you repeat that question, please? I'm just not sure how to answer that.
Sure. The question is, have you heard of or have any advice on the balance of the AFIX visits with clinic quality improvement visits that providers are also experiencing?
You mean other ones that didn't do well, whether they're improving or not? Is that?
I think the question is about scheduling time with the visits that doesn't also correlate with QI visits.
Well, as far as I'm concerned, they're all QI visits. That's why we go in there. We're looking to help them improve their visits. I mean, we teach the providers, if they want to do those kinds of studies themselves, that they can do that. Here in Suffolk County, we have a huge problem with the EMRs, or the electronic medical records, pulling the data from NICIS, so that they don't have to go into it's not double charting, so that once it goes into the EMR, it's automatically going to be pulled off NICIS. So what I usually suggest to the providers is use NICIS as a tool to see if the NICIS data compares exactly with what you're seeing in your EMR data. Honestly, the AFIX assessment is a quality assurance tool to make sure that we are improving our vaccination rates. Does that answer the question? If the person who asked that question, if that isn't the answer or clarify what you're looking for, could you please type in again if you need more further clarification?
Thank you. Next question is, do you use the AFIX online tool with your AFIX visits?
During the AFIX visits, I usually don't, because sometimes they're not on the computer when I go to make the visits. But what I have done is, if the practice is having difficulty with the registry, we use that as an opportunity to do real-time work with them in the registry and to show them different functions in the registry. One of the big things that the providers here in Suffolk had not been doing was inactivating children who are no longer part of their practice. They didn't even know they could do that. I'm sure that was buried in the information that they get from the state when they sign up for VFC vaccine. But, you know, private providers get bombarded with an awful lot of stuff. So when I go in there, if I can do a little real-time work with them in NICIS, that helps them, which is ultimately going to improve their AFIX assessments.
Thank you. The next question is, do you use a common assessment date for pre- and post-evaluations for all selected providers?
No, we don't. It's within the same window. It's like within that same quarter of our of our grant period. They're all done within that quarter, but it depends on what day of the week, because the way our assessments run in New York State, the computer, like if I go in there today, so that means that the computer is going to determine a study period within certain parameters. But if I do it all within that quarter, they're all within a few days of each other, I guess is the best answer to give you, because we run them all within a few days of each other.
Thank you. The next question is, we've had patients pass out even after having them wait 15 minutes after receiving the vaccine. Parents are then hesitant for their children to receive the next dose after that, even after explaining the side effects. Is there anything else you can recommend we say to the parents or patients so they're not so nervous or hesitant to complete the series?
Well, one big thing we always do is make sure they eat. I find most of the children who pass out, it's because they haven't eaten. And then we, of course, insist that they sit for 20 minutes afterwards. We do tell the parents that up front that, you know, a lot of times the children can pass out from this because they hold their breath and it does hurt. And we also don't like to vaccinate them on an empty stomach. I'm fortunate a lot of places where I go to do my clinics, there's always food around. So if they haven't eaten before the vaccine, we make them sit and we give them a little something to eat. But we do warn the parent that this can happen and that they shouldn't be frightened by it.
Thank you. The next question is, how can you help practices with missed opportunities for HPV and other adolescent vaccinations?
Could you just repeat that question, please?
Sure. The question is, how can you help practices with missed opportunities for HPV and other adolescent vaccinations?
Well, again, what I do, what I say to them is use every single opportunity that you see in adolescent as an opportunity to vaccinate. They want working papers. They come in because they have pimples. They come in because they need a note for something else. They want a sports physical. Every single opportunity use to get them in to vaccinate them. I have heard with some of the HMOs sending the kids gift cards for Dunkin' Donuts, which I don't think is a really good idea because of the obesity issue, but they've also given them gift cards for, what are some of the other things, like iTunes gift cards. I've heard them give them to get them to come in. But I mean, like I said, I work for the health department, so there isn't too many incentives that we can offer to people. But the big thing is every time you see an adolescent, use every single opportunity, no matter what they've come into the office for. The other thing, too, is there are the reminder recalls. Another thing that is a big thing that's also been supported by the literature is text messaging. And there are several free text messaging services that you can get in the private provider that the private providers can get access to, and it text messages the adolescent and the parent. I know there's HIPAA issues related to text messaging the adolescents, but from what I've heard from the private providers is they've got like a little form that they have parents sign off on when the children come into the practice in the beginning and say, can we text message your child as well as you for reminder recall or something to that effect. And that's extremely effective in getting the adolescents to come in, is text messaging. And not just to the parent, to the adolescent as well. That's backed up by the data.
Thank you. We have no final questions.
Excellent. And so with that, it looks like we've got 3 minutes to spare, and I'll go ahead and say thank you once again to Dr. Koslap-Petraco for sharing your insights and expertise and for answering 23 questions in the past.
I'm thrilled. I am so excited because I get onto these things and nobody asks any questions. So I want to say thank you very much to all my colleagues out there who asked all of those questions. And also thank you for those who helped me with my brain freezes because I couldn't remember the name of the person who did that terrific presentation. And somebody reminded me it's the Yellow Umbrella Program.
Excellent, yes. Yeah, I think we've heard her a few times at partner meetings, and Christine does a great job.
She's terrific.
Excellent. Well, thank you to everyone who has participated. We really appreciate your time and all your efforts, and stay tuned for another preteen vaccine webinar, which will probably be coming up the first week in November. So be on the lookout for an announcement. Thank you so much, everyone, and y'all have a great day.